Tonight, we continue to follow the three-day strike against Kaiser Permanente. Our crews were at the Kaiser Interstate office in North Portland this morning and noticed a sign saying the vaccination site there is closed because of the strike, which ends Saturday morning. Kaiser officials told us today that they've had to postpone some non-urgent and elective surgeries to make sure that they do have enough staffing for critical patients. They tell us they've blocked out time in the coming weeks to try and catch up on the surgeries. As far as the strike itself, Kaiser says they are working with coalition leaders to set the next bargaining meeting. Yesterday, union members told us Kaiser was walking away from negotiations until the strike is over on Saturday morning. And since we love to give you context and deep dives on big issues like this, we've looked into the history of Kaiser and the unions. It's been rocky at times, but over much of the past 25 years, Kaiser and its unions really have been kind of a gold standard for how companies and unions can thrive together. Yeah, I did say that on purpose, thrive. Their unique partnership avoided even short strikes like we're seeing now and elevated Kaiser to a national healthcare leader. But obviously things have changed. Let's take a look back in time to get a better idea for what is happening now. Kaiser Permanente is a company that would have never launched without the help of unions. In the 1940s, after World War II, Henry Kaiser was going to shut down the system of health care for his workers. But the Longshoremen's Union said if he'd keep it going, they'd send all their members there. And the system took off. Over the years, several unions began representing Kaiser workers, and it's not always been an easy ride. In the late 1980s and into the mid-90s, there was plenty of labor turmoil at Kaiser, including strikes. In 1995, 27 local unions created a coalition to better coordinate their bargaining with the healthcare giant. In a Kaiser video, the founding executive director of the coalition recalls that troubled time.
This upheaval and the introduction of these concessions, not only at the bargaining table, but also at the workplace, became such a distraction to them that they felt that they were violating their commitment to quality care. And so the time came when we had to make a decision as to how to proceed.
In that same video, David Lawrence, who was chairman and CEO at the time, remembers what it was like to hear the union leader lay out a plan where the two sides could work closely together.
And he starts talking about this stuff, and I honestly had to fight to keep from crying. It was like, holy crap, this really is exciting to listen to. This is exactly what we had to do. And I responded by saying, look, healthcare involves teams. You can't do it without teams. If we're fighting with each other, we can't take care of patients.
So they struck a bargain. Kaiser would share financial information with union leadership, and managers would ask their employees for help solving problems. This recent article by Healthcare Dive spells out the details that helped Kaiser become a leader in the industry in terms of quality and affordability. Those who were involved in the historic agreement back in 1997 said it made sense to cooperate.
They wouldn't help us as union members if the organization went out of business. So what they try to do is say, okay, let's sit down and strategize how we can work together, bringing the organization to the forefront, but also strengthen the union at the same time.
Although for some, it would take a bit of getting used to.
It wasn't as radical to us because as nurses, I guess, we collaborate. We have to on the units. We're collaborating with the physicians, with the LVNs, with the patients' families. We're used to working together. But I think what was radical about it was, wait a minute, these guys have been trying to kill us all for 3 years, and we're going to now try this.
But they did try it, and it worked for many years. I talked with Donna Warner with SEIU 49, a Kaiser union in Portland. Although she's now on the picket line, she worked as a medical assistant in 1997 and noticed a big change after that agreement.
Absolutely. After we formed our partnership, they really invested, and those doing the work know the most about improving it. And we improved our patient care. We became, I'm losing my word right now. We became preventative focused in our healthcare and was helping people before they needed to go to the emergency room.
But now she said things are different. In 2018, the coalition, which represents 34 unions, broke into two groups, with 22 leaving to form the Alliance of Healthcare Unions and the rest staying with the coalition. It's the coalition which is on strike now. Over the years, David Lawrence left, and while other CEOs took up the banner of collaboration, union members say things have changed.
Warner, who now works for the union, said the change started about 10 years ago.
The dynamic really started changing where we weren't working together anymore. Our voice wasn't being heard anymore. And quite frankly, the patient, what used to be in the center of our value compass, was no longer being talked about. And ever since then, it's been a steep decline in us working together and being able to resolve issues together.
I wanted to talk to someone from Kaiser today, but they did not have anyone available to be interviewed. But a spokesperson pointed out that Kaiser does have a long, proud history of working with their unions, that it's the largest employer of union-represented healthcare workers in the country, with 40 unions covering 160,000 people, and that 1997 agreement is still in place, making it the longest-lasting partnership of its kind in America. Let's hope that both sides can get back to the cooperation that existed shortly after that agreement took place.